Hello, my name is Marilyn Kim, and I am writing for the Pre-Health Professionals Liaison position for the 2020-2021 school year for CRD. A little bit about myself. I am a rising fifth-year senior. I'm majoring in public health science with a certificate in women's studies. I'm also doing a reverse transfer degree with the College of Southern Maryland with a pre-pharmacy degree. My goal is to become a physician. I would like to become an OBGYN, and my ultimate goal is to get involved in healthcare policy and eventually open up my own women's healthcare center for women who live in underserved locations and for underserved populations, focusing mostly on minorities. On top of being CRD secretary, I have had the opportunity to serve as Do Better's internal membership and service coordinator for the school year. So I've been serving on 2 e-boards this year. I've also been a member of the Student Success Leadership Council. I'm also a Rawlings Fellow for the Rawlings Undergraduate Public Policy Program. And I work 2 jobs. So I've had the luxury of taking 16 credits or more, and being heavily involved with on-campus activities. In addition to these things, I'm also the founder and CEO of my own nonprofit organization, which is called For My Sisters, which I have also been running programs for throughout the year. So I think that being a part of any e-board, especially the CRD e-board, you have to have a very dynamic personality, and you have to be very upbeat, especially with the pre-health professionals liaison position. It really requires a lot of communication skills, and I think that as the current secretary, I've had the opportunity to exercise my communication skills in addition to creating unique bonds with members of the organization. As a secretary, I've also had to find different ways to navigate conflicts that may have happen for members, especially when it comes to points, and just finding different ways to use levels of discernment and assisting those individuals who may be confused about how to achieve points through the 3-2-1 rule, which is mandatory for all members which is mandatory for all individuals to become members of the organization, or just problems with points where points may not have been added where they were supposed to, which may affect the eligibility of someone to become a full member of the organization. I believe that the pre-health professionals liaison should have an upbeat and bright attitude about themselves, which makes them presentable in the presence of health professionals. And I really believe that the pre-health professionals liaison should have excellent communication skills. I believe that because of my past experience of serving as a secretary and handling the more clerical duties of what's involved with being on this e-board, I think that it would be a smooth transition for me to go from being the secretary to being the pre-health professionals liaison. I've had experience with using MailChimp, I've used SurveyMonkey, and I've also used the different templates that we use to send out formal notifications and emails to our members, so it would definitely be a smooth transition. Additionally, I believe that serving on the e-board, it should be I believe that the pre-health professionals liaison should be able to manage a lot of things at one time. As I've said previously, I'm not a stranger to being busy. I've had a busy semester, working 2 jobs, taking 6 classes, taking 5 classes, and being pre-med, and just trying to keep a decent social, academic, professional life. I think I've been very good at doing the balancing act of trying to keep a certain adequate level of everything that I do. And I work extremely hard in all aspects of what I do. I always give 110%, and I'm always on top of the things that I stand for. I believe that the pre-health professionals liaison is more behind the scenes position, which is something I'm very interested in because I've had the opportunity to be more in front of the scenes with assisting with points and creating the newsletter and just making sure that people know what's going on with CRD. But I would definitely like to be able to navigate a more behind the scenes approach towards still contributing to the mission of CRD as a whole. Additionally, I believe that the pre-health professionals liaison should know how to communicate with the pre-health professionals that are invited to these events. And I think that one thing that often gets overlooked is the other pre-health interests within the organization. which I think we focus heavily on pre-medical students and pre-dental students. But as a transfer student from a community college, I'm well aware that everybody doesn't want to be a doctor. Everyone doesn't want to necessarily be a dentist. There are people within our organization that would like to be nurses, that would like to be doulas, that would like to be physical therapists. And I think that with my knowledge of understanding, navigating through different majors, as I've changed my major 3 times, I went from biology to economics to now public health science. I think that I've had a good background in understanding the different avenues that one may take towards achieving the pre-health profession of their choice. And I think that because I have had the opportunity to actually engage with different aspects of medicine and different aspects of pre-med, that I know the different ways that somebody may be trying to achieve those goals. So I wouldn't want to leave out those who are trying to become physician assistants or physical therapists or doulas or midwives. I would definitely want to encompass different ways to create connections between what our members are interested in achieving someday and what people are actually doing in those fields that they're interested in, especially when it comes to different levels of especially healthcare policy and pre-pharmacy, pre-dentistry, just different avenues. And I think that I have definitely just figured out those ways for myself. It's taken 4 years, but I think that everything that I've learned throughout these 4 years at the University of Maryland has definitely equipped me well for this position. And I'm sure that if you choose me to become your pre-health professionals liaison for the 2020-2021 school year, you will not regret it. And that is it. Thank you so much.